Welcome back everyone. Today I'm going to show you some exercises to give you some pain relief from shin splints or even prevent you from shin splints in the future. Now shin splints is also known as medial tibial stress syndrome. So this is caused usually by a lot of muscles and tendons and even the skin sheath around the bone of your shin rubbing in against each other, causing inflammation and causing pain in the medial or the inner shin bone. Now this is normally caused by new repetitive movements. For example, if you only started running due to COVID and it's the only way you can get some exercise, or you've been running more than usual and there's a lot of repetitive movement and causing muscle and bone to rub against each other. Now this can be caused from new shoes and you only started running, or poor running shoes even, or you just started playing a new sport and you're getting a bit of pain in your shins. Now you're more predisposed from shin splints, especially if you have flat feet or even a rigid arch in your foot. So your foot also acts as a shock absorber when you do a lot of running or jumping. So if you have poor dynamics in your foot, you can get shin splints as well. I hope these exercises helped you as much as they helped me and my patients.
Calf raises. Calf raises can almost be done anywhere, but I want you to do this next to a wall or a chair so it can help you keep balance, so you don't fall over and create another issue that you need to fix or another injury. For this exercise, go on one foot and raise your heel off the ground. Try to squeeze your calf muscles, also known as the gastrocnemius muscle, as hard as possible at the end of the movement, around half a second to a second. This will ensure full muscle recruitment at the end of the movement. Do 10 to 15 repetitions, 3 to 4 sets on both sides. To increase the range of motion of the calf raises, you can do the exercise off a step or a large phone book or a stool like me. This will stretch the calf muscles as you go all the way down and increase the range of motion for dorsiflexion, which is very important for such sports such as Olympic weightlifting, powerlifting, and prevents lower back pain. By doing this variation of this exercise, you increase flexibility and mobility of your ankle joint. The calf muscle is one of the main muscles that help you jump, run, and also is connected to your Achilles tendon. So by having great calf muscles, it can absorb the impact of each step when you run. This will reduce shin splints, stresses of the Achilles tendon, and also injuries in the future. SOLEUS tiptoe walk. To do this exercise, walk with your heels off the ground and bend your knees. Do not bend your back too much or lean over too much. This will load your back up and not the muscles in the soleus. A slight bend in the back is enough. This exercise may be too easy without weight, so I advise you to be holding 2 dumbbells on each side of the body or 2 buckets of gravel or sand if you can't find any weights. I didn't have much room to film this portion of the video since I filmed it in my lounge room, but you definitely need to do at least 50 meters to 100 meters of a walk, and then have a rest for about 1 or 2 minutes, and then do the exercise again 3 to 4 sets. Make sure you do this with some weight so you can feel some sort of stimulus in the soleus muscle, so you actually can get some muscle gain or strength gain in the muscle itself. The soleus is a muscle that runs along underneath the gastrocnemius muscle, which is the main calf muscle. However, the soleus doesn't cross past the knee joint. Hence, we are bending our knee in this exercise to eliminate gastrocnemius activation and concentrate on soleus activation instead. A research paper was published in 2016 investigating on the factors that causes physically active individuals to be at risk and develop medial tibial stress syndrome, also known as shin splints. The results showed that primary factors that appear to put individuals at risk were increased BMI, which is being overweight, increased navicular drop, having flat feet, or greater plantar flexion range of motion and reduced dorsiflexion, meaning you can't point your toes up, but you can definitely point your toes down really well. So I highly recommend taking these results into account to fast track yourself into the road of recovery. If you have any of these predisposing factors, it will be a great help if you address them first, and that way it will fast track you to reduce injuries in the future and also recover a lot faster. Standing fire hydrants. Slightly bend over in a standing position, and with your knee bent, move your leg away from yourself and slightly back as well. This will bring your hip into a slight extension when you abduct your hip away from your body. The thigh should never be in front of the body. This will create flexion, and that's not what we want. We want to have our hips moving back into extension. That way it activates the glute minimus. By leaning your body a little bit forward, it activates the glute minimus a little bit better and creates ease with hip extension. This variation of the exercise is a great way to train and strengthen the glute minimus muscle, which is very important for posture and knee pain, especially if you can't get on and off the floor. Do about 10 to 15 repetitions and alternate both legs 3 to 4 sets. If you find this exercise too easy, I recommend using a resistance band. I'll put a link in the description box below on where to get them. The resistance band will pull your legs and thighs together, making this exercise a lot harder by adding the resistance against the exercise. Strengthening the glute minimus is very important to keep your knees externally rotated and your knees away from each other. By having your knees pointing inwards during running or walking, you may not only suffer from shin splints, but also possibly knee pain or even flat feet. So having strong glute minimus muscles is very important. Floor fire hydrants. Go on the floor on all fours with minimal lumbar twisting. Activate your core and abduct your leg away from your other leg. Make sure when you abduct the leg away from the other leg, you also slightly bring it backwards as well. This will create hip extension and activate the glute muscle a little bit better. Try not to flex your thigh in front of you, but slightly back as you pull the leg away from your body. Do about 10 to 15 repetitions on both sides, 3 to 4 sets. If you still feel that this exercise is too easy for you, you can always use a resistance band. The band will try to pull your legs together, adding to the resistance that you're trying to fight against. This will make you look like you're a dog going to the toilet on a fire hydrant, hence the name of the exercise. I found that in this position I had a lot more control compared to the standing variation, which allowed me to concentrate on activating the right muscles of the glutes, instead of trying to balance on one leg during the exercise. Banded ankle dorsiflexion. Find a wall or a chair that you can stand next to so they can help you keep balance. Just in case you feel like you're about to fall over, you can always lean on the chair or the wall. Get yourself a resistance band and place it on top of the foot that you're trying to work on, and under the other foot that is assisting you with the exercise by anchoring the band down. Raise your leg up slightly so there is slight tension in the band, and then flex your foot up like you're trying to point your toes towards your face, and then relax back down again. But try not to lose the band as it slips off your foot. Try to keep it on the top of your foot. Do this for about 10 to 20 repetitions and repeat the exercise on both legs or both feet 3 to 4 sets. If you're like me and you find that standing on one leg is too hard, I recommend doing this exercise sitting on the floor. Just anchor the resistance band on a leg of a heavy table or a pole. Here, I'm using a heavy leg of a sofa. Place the band around the top of your foot and move slightly away from the anchor point so there is tension in the band. The band should be pulling directly back from the bottom of your foot. Whilst keeping your legs straight, point your toes back towards yourself and then relax again, but try not to lose the band slipping off your foot. Do this for about 10 to 20 repetitions and alternate on both feet 3 to 4 sets. This exercise will strengthen the tibialis anterior muscle, which is the muscle in front of your shin bone. The main action of this tibialis anterior muscle is to dorsiflex the foot, meaning bring your toes up. This is very important in walking, running, as it helps the foot placement on each step, and also very important for Olympic lifting and powerlifting and squats as well, as it's important to be able to create dorsiflexion when you squat deep and move down so your ankles can move properly, as it's the antagonist of the gastrocnemius. If this muscle isn't strong enough, then walking and running may place a lot of stress and strain on other joints and ligaments on the leg, causing pain, inflammation, such as issues like shin splints and possibly injuries in other places as well. maybe even the lower back. I recommend using a light band first and gradually use a strong resistance band, otherwise you may make your shin splints worse or even cause another injury. Banded ankle inversions. To do this exercise, sit on the floor with your legs straight and place the band around the top of your foot and with the other end anchored around a leg of a heavy table or pole. Move slightly back so that there is a bit of tension in the band. The band should be pulling away from the bottom towards the outside of your foot, which is the opposite direction of where you're trying to pull your foot. To activate and train the tibialis posterior muscle, which its main action is ankle inversion, pull the foot inwards as you slightly point your toes towards yourself. Do this 10 to 20 repetitions and alternate on both legs 3 to 4 times. The tibialis posterior muscle helps with foot placement. If the muscle is weak and fatigues easily, a lot of inflammation and pain can come from this area, which is the medial portion of the leg. So I highly recommend using a light resistance band first, then use a heavier one once you're ready. Otherwise, you can probably cause more pain and injuries instead of actually helping yourself.
Once again, guys, thanks for watching. I want you to join my VIP Facebook group. I want to build a community there where you can ask questions. I will try my best to answer them as soon as possible. There'll be other health professionals in that group already there waiting to help you as well. Now, if you found this video helpful, there could be a good chance that you have tight calf muscles. So check out my PNF calf stretch video. That video will definitely loosen up the ankles and the muscles that could be causing you shin splints as well. Now, if you do have pain under your foot or even heel pain, you could be suffering from plantar fasciitis. So check out my plantar fasciitis video. That video will definitely give you some pain relief from plantar fasciitis. Now remember, support my channel, hit like, hit subscribe, comment below if you have any questions, and I'll see you guys in the next one.